crowd of adolescent population in India is about 17%, and Puducherry, because in Puducherry alcohol is easily 13 to 15 years. The current tobacco users as of 2019 was found to be 7.3%, and smokeless tobacco users almost 4%. And these smokeless tobacco users are gradually increasing in the form of cool usage. I will tell you in subsequent pictures. That is also a tobacco product which, for these adults and the adolescents. At what age they start using, especially the age of alcohol usage. Alcohol is previous slide we have seen regarding the tobacco usage strategy, where the target 3.5 states that the substance use are commonly using these terms: substance use, substance abuse. One thing is legally permitted, another is illegal substance. One is approved by the law, causes problems such as trouble with work, family, or their own health. So they continue to use even they know that it is affecting their own health. Circumstantial, it is because of peer pressure they start using this, and they start using this every day. Especially because of the socially they use this, start using this. Then they develop this craving and seeking for the drug. Then they use the drug very often. So finally they develop this addiction. So they continue to use despite the harmful effects that they face. The same thing. Okay. So what are the factors that are leading to this addiction finally? So first we start with environmental factors and peer pressure. The friends will be saying that this is very cool, so you start using this. So peer influences, their community attitudes, poor school achievement. If they are not performing well in the school, they tend to look for many other opportunities. So these are very easily, so they will use these drugs easily, and finally they will start with this marijuana, that is other is ganja, cocaine, heroin, inhalants and solvents, amphetamines, that is CNS stimulants. But still, I have been seeing this thing used by even adults. That is the cocaine. It is used in the form of snorting. They just inhale this powder form, and heroin. They are just injecting this in the form of IV, and these inhalants, whether they are in the form of petrol. There are many forms of smoking forms in India, all those things. There are also enough number of smokeless forms, starting from this pan, zarda, gutta. So many varieties of these things are available. Again, these are the same smokeless products: gutta and pan, mawa, kairi, pan masala. So what predisposes these adolescents to these substances? All these are nicotine products, highly addictive substances. So there could be genetic predisposition, or family or environmental disturbance, mental health of the adolescent may be disturbed. So all these things are predisposing the adolescents to use these substances. So mainly in colleges, the peer pressure will be the one factor which is having a huge role in this, and stress, curiosity, just to try what is the new in this thing. So anger or rejection. So all these things are forcing these adolescents to use these substances. So in general, these are the reasons: peer pressure, gain acceptance in social circle. So they will be accepted in that peer group. Media exposure. In every movies or OTT platforms we see, in all the other forms we generally encounter this situation. experiment with the substance, and they want to experiment. Once they start with the lower amount of substance, they always want to experiment with the higher amount of substances. That situation is the concerning issue because age of initiation is progressively falling. Earlier it was 15 years, now it is 14, going even toward habit, and leaves their tension, acceptable to friends, and some may admire this and they will start using this organic use. And this is the temporal order of use of substance. This is the stage here, I told you. Initially, they start with the lower order substances like alcohol or cigarettes or cool lit. These are the lower order substances. It goes unnoticed, and slowly they will not get that high when they use these normal substances. So they want to use higher order substances. So they will slowly go into this ganja practice or opioids, cocaine, stimulants. So slowly they will move on to the higher order substances. What are the signs of drug abuse? They will have these bloodshot eyes. Their pupils may be larger or smaller than the usual observance, or changes in appetite. They may feel or sleep patterns. They may not be sleeping properly. Sudden weight loss or sudden weight gain may be there, and there will be a deterioration of their physical appearance. Unusual smells on their breath, and impaired coordination. If any job is assigned to them, they won't be able to coordinate properly and make it done. And behavioral warnings, poor work, declining performance. There could be some financial problems because they want money to buy these products, and they will have secretive behaviors and sudden change in friends. Accident, they will be accident prone because with impaired coordination or concentration, they will not be able to drive or travel properly. Accident prone, lack of motivation, and whatever they felt pleasure before, now they won't be doing that job. They will be withdrawn from the pleasurable activities. Unexplained anxiety. Effects of drug abuse be slow. So that is why when somebody is drunk and their alcohol concentration is more than 30%, their reflexes will be lost. When somebody is coming in the opposite direction, they will not be able to suddenly turn and go to the other way. So their reflexes are lost. So distorted vision problems, memory loss. Some of the drugs are having these blackout things. So memory loss will be there, blackout. So these are the screening instruments in any psychiatric OPD or any reagent center. These are the screening OPD or any for research purposes. These are the screening instruments used commonly. One is ADDI, UZI, POSI, RAPI, SASI, TASI. So all these are named instruments, validated instruments. So you can use these instruments to screen for somebody is using these or not. So there is one act which is enacted in the Parliament. There is a Narcotic Drugs and Psychotropic Substances Act 1985. So it prohibits a person from the production, manufacturing, cultivation, possession, sale, purchasing, transport, or consumption of any narcotic drugs or psychotropic substances. So this is the one act which prohibits all the narcotic drugs. And based on the whether the person is consuming or supplying or possessing, based on the type of activities you will be punished. Generally, it varies. Because if you go into the legal act properly, so less than 1 kg or 1 to 10 kg or more than 10 kg, how much other is they are possessing, based on that the punishment varies. So in general, the imprisonment would be not less than 10 years and not more than 20 years. And the fine also will be there, that is not exceeding 1 lakh. So some of the laws pertaining to alcohol use, this alcohol is coming under the state subject under the Constitution of India. So this thing varies from state to state. In Pondicherry, legal age for drinking is 18 years. Whereas in some states, the legal age is 21, and some other states, the legal age is 25. And in some other states, the alcohol is totally banned or prohibited, like Gujarat, Bihar, Nagaland, Mizoram, as well as in Lakshadweep. These are the states where alcohol is totally prohibited. So narcotics, tobacco, alcohol. This is the third thing. There is tobacco. So it is governed under the act called CODPA, Cigarettes and Other Tobacco Products Act. So this was enacted in the year 2003. Later on, so many amendments was done to this act to make it more stringent. So this earlier in 1975, he was governing only the cigarettes. Later on, to make it a broader term by inculcating this smokeless form as well as smoking forms of bidis, all those things. So the term was, the change to COTPA, Cigarettes and Other Tobacco Products Act in 2003. There are totally 33 sections under this act. Some of the main features I'm going to elaborate. One is the smoking is prohibited. It is actually, they are prohibiting the smoking from a closed space. They are not prohibiting smoking behavior in the open space like bus stops or beach or park. That thing is not being prohibited. And they want, in all public places, they want to display this signboard. No smoking area. Smoking is offense. So that kind of signage is expected out of this law. Some of the other provisions are prohibition of these advertisements. No person can advertise this in any form, or no person can promote this usage of tobacco, or no person can promote those activities. And restriction of tobacco use in films and television. And anti-tobacco health messages. Whenever we go to movie, we will be seeing this 30 seconds of this disclaimer message ads that will be going on. Later on, this was converted to this child and the smoke ad. Because people are getting desensitized for those earlier things, so they want to introduce a new ad. And prohibition of sale to minors less than 18 years, and the prohibition of sale within area of 100 yards for any educational institutions. And pictorial warnings, at least 85% of the prominent display area should be covered with these pictorial warnings in the tobacco products. And it should be legible, and the language in which specified warning should also be expressed. So that 85%, at least 60% is dedicated for the picture, and 25% is dedicated for the textual message. So these are the main provisions we have already discussed. Prohibition of smoking in public place, prohibition of advertisement, prohibition of sale to any minors below the age 18 years, and prohibition of sale within 100 yards of any educational institutions, and depiction of pictorial warnings. Tobacco-free education institutions. So this thing will be talk more about this process by Dr. Surya sir. So I'll skip this process. So these are the punishment under the COTPA Act, and various act also is punishing for using or handling these nicotine products. And under this COTPA Act, the punishment, especially the fine amount, is not that huge. So say it is not going to be more than 3,000 rupees at any point of time. So if they are smoking in public place, it is only 200 rupees fine. And sale of tobacco products to minors, it is only 100 rupees. So there is not much, a huge amount of fine levied on those people. So they have to revert to this Food Safety and Standards Act 2006, where they can charge a heavy fine. Up to 10 lakhs rupees they can charge under this act. So if they find any food substances that are smeared with nicotine products. And the classification based on the drugs, these narcotic drugs, and years of punishment. So finally, why are we concerned about the adolescents using these tobacco products, these substances? Alcohol-related road traffic accidents leading to sudden death among youth, sharing needles and injectable is IV drug use, that is transmitting many bloodborne diseases, especially these HIV, hepatitis B and hepatitis C. High risk behavior among these youth, leading to sexual risk-taking, sexual victimization, and aggressions in verbal learning, visual, spatial processing, memory and attention. So all these neurocognitive aggressions are going to happen in them. So there is a health impact, social ramification and psychological effect. So coming to the treatment, so there is a problem with the treatment also. They don't come forward on their own. Okay, and they will be under pressure from their family to go and get the treatment. So they always disobey the treatment. They will not be continuously follow with the treatment. They will not obey the treatment protocol. Ethical issues, we need to obtain a parental consent before starting the treatment because they are less than 18 years, if they are less than 18 years. And we need to maintain the confidentiality also. That is also, there could be, that also a delicate ethical issue. Okay. What are the treatment options available for this substance abuse among adolescents? So first we will start with this therapy support. It can be counseling, repeated counseling. If it is not working out, if it is a severe case, then we have to resort to this medication-assisted treatment, and along with that, rehabilitation programs can also be conducted for them. So once we put them in the treatment, this is the behavioral change that we can anticipate. So one, pre-contemplation, that they are not aware of their problem. They say, I'm not addicted, I can come out whenever I want. So they will be in the denial phase. Then we have to repeatedly counsel them. So if you started using and if you are regularly using, then you need to be treated. Then they will come to this contemplation phase. Okay, maybe I may be addicted, something like that. They will be in the confused state. Okay, I should get the treatment, or I may not. Likewise, the pre-contemplation to contemplation phase, then they will prepare their mind for getting the treatment properly. Then they will put it into practice. They will take the action and maintenance phase. They will sustain the behavioral change. They will quit that behavior and they will sustain this behavior. This is the process. Usually takes 6 months. And if you don't monitor them properly, there is a high chances of relapse also. So 50%, more than 50% of the youth will be resorting to the this addiction behavior. Counseling plan, it is tailored to each and every individual, personalized approach, and we need to set a good date if they are using tobacco product, and we need to identify the triggers, explore the use of replacement therapy if they are using cocaine, and we need to identify what replacement therapy can be given for that, and implement the behavioral strategy, discuss the importance of stress management. If they are, the stress is the one which is triggering them to use this tobacco or alcohol, we need to discuss that stress management and help them to adopt a healthy lifestyle. So this is short-term 5 years of tobacco cessation. Whenever we go to the field, RSTC, USTC, generally we use this term. One is ask, assess, advise, assist, and arrange. A short form for any patient. We need to ask whether do you use this tobacco. It's like asking everybody. And assess if they are using, how much they are using, and when will they quit that behavior. Advise them to quit this thing, and assess, help them to get out of this thing. Programs, the higher education or school education, they need to raise awareness among their children, among their youth or adolescents. Parental involvement is also plays a huge role. So they need to regularly monitor these youths. 18 tobacco cessation centers and 3 de-addiction centers in Puducherry district. So all these things are there, so that is accessible also. And community, and the last thing is community engagement. To promote the positive behaviors, we need the community also to be engaged in this. So in the schools or in the colleges, they need to teach this social resistance skill training. That is, they should be trained to say no. Okay, that is a refusal thing. Behavior should be taught to them, and normative education. They should be taught the social norms and values, and this moral education should be taught to them. Competence enhancement, skill training. So what can be done and how this can be done? So involve the parents and guardians, will be life skills, and the importance of schools in prevention work. And we need to recognize the early the warning signs and establish the support network. So this is the overall plan. So The police personnel would be helping in the curbing the supply chain, and the initiation thing would be the educational department or the parent should be proactive enough to curtail this at the initiation level. And then comes the yearly identification, treatment, counseling, and support groups. So that would be the responsibility of the medical people. So support for the family also needs support, and they in the form of family counseling to help families out to cope with this youth in their house. Community support groups, they can be shown with whether already a triggered child, how he is moving in the society. That can be there could be community support groups that can be formed. So how we are failing in this tobacco control? So these are the reasons why we are failing. So it is generating ready use, especially this tobacco, and political will is half-hearted, and lack of self-control and moral education, and glamorous ads, especially by these celebrities on different kinds of substance use, employment opportunities to millions globally, especially tobacco cultivators and the selling people. All those things are developing employment opportunities. And finally, the cultural practices, especially the older generations, they are chewing these smokeless forms in their houses. So all those things are giving tough to break this control. So there are many programs associated with this curbing this substance abuse. One is National Tobacco Control Program. Another is Nasha Mukt Bharat Abhiyan. Another is Rashtriya Kishore Swasthya Karyakram. Last one is Central Sector Scheme for Assistance for the Prevention of Alcoholism and Substance Abuse. We do this National Tobacco Control Program. In the central, that is managed by the National Tobacco Control Cell. In the state, it is managed by State Tobacco Control Cell, and the district is by District Tobacco Control Units. And the district is the ultimate DPS for implementing all these strategies, starting from tobacco cessation, school health programs, IEC, that is Information Education Counseling, training, and monitoring tobacco control laws and reporting. So all these activities are done in National Tobacco Control Program in the entire country. So start at the center, it is the ministry, and the state level, it is state level Nasha Mukt Bharat Committee. And there is a similar district level committee is also there. And finally, the municipalities which are going to implement these things. So Narcotics Control Bureau will be curbing the supply chain, and the Social Justice Department will be doing these awareness programs and treatment facilities. So this is the district level Nasha Mukt Bharat Committee. Mainly they will be involved in the awareness generation among the schools and colleges, and cessation programs. All those things will be planned by this Nasha Mukt Bharat Committee. Rashtriya Kishore Swasthya Karyakram, it is under the Ministry of Health and Family Welfare. So basically they are targeting wholesome for the health of adolescents, and added to that, one of the component would be this preventing the substance abuse among the adolescents and youth. And the strategies would be peer education, quarterly adolescent health day they will be observing, and they will be educating regarding the how this the addiction behavior is there, what warning signals, how to get rid of all those things. Those kind of peer education would be provided. The last one is this Central Sector Scheme for Preventing of Alcoholism and Substance Abuse, and it is also under the Ministry of Social Justice and Empowerment. Basically, they provide financial support for all these activities, starting from awareness generation, running these de-addiction centers, de-addiction camps, NGOs who are involved in the drug use prevention, and the surveys. So for all these things, they provide financial support. And training and sensitization programs, basically, this is a national oral health program. That program, under that program, all the dental colleges would be screening for this tobacco usage practice, because just by looking at their mouth, whether the lips are stained, or the tongue is discolored, or the teeth is discolored, based on that, they simply easily identify those users and then they will send them to de-addiction center or tobacco cessation centers. National Tobacco Elimination Program. Under this also, because the tobacco users are threefold higher risk of getting tuberculosis. So under this also, they heavily sensitize about non-usage of tobacco products. NACO, this NACO, because these injection drug users are 5 times higher risk of getting this HIV and hepatitis B, hepatitis C. So this NACO would be running this sensitization programs, awareness camps, especially to get rid of that injection IV drug use practices. And NCDs, under this program, prevention of substance abuse is the main motto in those programs, because for any NCDs, any non-communicable diseases, this drug abuse can play a role. National Mental Health Program, because mental health is a basic issue in this thing. So for promotion of that, they will also develop awareness activities or sensitization activities. So who are the stakeholders for this curbing these substance abuse menace? So starting from health, education, police personnel, social justice and empowerment, women and child development, agriculture, labor, non-governmental organizations. So there is a huge list of stakeholders for acting on this one problem. It is not just the problem of education department or health department. There are various departments are involved in this. Multi-sectoral coordination is required to completely erase this or curb this menace. So we are also observing a few days to for creating awareness on this thing. 31st May every year we are observing for World No Tobacco Day, and this year it was celebrated. It was observed with the theme of protecting children from tobacco industry interference. Next month, that is June 26th, we observed this International Day Against Drug Abuse and Illicit Trafficking with the theme of evidence is clear, investigate prevention. So here the evidence is, we have listed all those evidences, peer pressure, family, environment, all those things. So the evidence is clear, so we need action. October 2, there is on Gandhi Jayanti commemoration. So we observe this World No Alcohol Day. This year we observed with the theme of say no to alcohol and selling alcohol to minors. Again, it is projecting towards the youth and adolescents. So there are so many helplines. One such is Quitline that is there. So if you want to make any complaints or doubts, you can call this number. There is a free helpline number. So they will register the complaints, they will clear the doubts. State Tobacco Control Cell is also there. So you can also call that State Tobacco Control Cell in Puducherry. And we have this National Toll-Free Drug De-Addiction Helpline number is also there. So that can also be called for help. So this app is developed by the Government of India for you to make this process easier. So you can make a complaint there, and you can also check for the status, whether they have taken the action or not. So all these things are there in one portal. So making a complaint and checking the status whether it has been rectified or not. AIM Cessation, it's a digital health initiative under the National Health Mission for tobacco cessation. So if somebody is having tobacco addiction, so they can call this, they can give a missed call to this number, and once they register, they will start sending messages, SMS messages to the concerned individual. So in Puducherry, we have this State Tobacco Control Office, where the duties are training the health and social workers, NGOs, giving education in the form of IEC activities, monitoring the tobacco control laws, coordination with other village level Panchayat Raj institutions, advocacy, and running these cessation facilities, setting up, strengthening of these cessation facilities. So totally we have got 18 tobacco cessation centers in Puducherry, and yesterday also the Collector Sir had inaugurated one center in Laspet Urban Health and Training Center. So in total we have got 18 tobacco cessation centers. And we also have 3 de-addiction centers in Puducherry. So one in IGMCRI, that is run by say Department of Psychiatry. So every Wednesday they also run this adolescent clinic. So they mainly treat these withdrawal symptoms, medical condition, and motivate. That is counseling. All those things are given to those patients. Apart from IGMCRA, JIPMER is also having this de-addiction center. And third one is there in Aryabhavam, that is Bharat Mata. So there are totally 3 de-addiction centers for any drug abuse we have got in Puducherry. So do you have any doubts?